This is a video brought to you by NHS Tayside Children and Young People's Occupational Therapy Service on sensory processing and daily occupations. Our department has been running these training sessions for a number of years now, and we know that raising awareness of sensory processing to those who are closest to children results in the best outcome for the child and family. We know that children's sensory processing difficulties are often most obvious and prominent when children are surrounded by those they trust, when they're at home or at nursery. So today's session is about increasing your confidence in recognising how your child's occupations may be affected by sensory processing difficulties. We hope to provide strategies to support your child's sensory preferences, and we'll give examples that you can use in your daily routine, including some useful equipment. And there will also be some suggested online resources and reading, which you can do at the end. As occupational therapists, we are interested in day-to-day occupations, with occupations being the things that you want to do, need to do, and are expected to do in your everyday life. Some examples of these can be getting dressed, having your hair cut, eating meals, learning to ride a bike, all things that we do that have a purpose and meaning. All these occupations make up our day-to-day life and the certain habits and routines that we have. All of these occupations can be impacted by a child's sensory processing. As occupational therapists, we are interested in sensory processing because it can have a significant impact on a child's ability to participate in their occupations. And these are some of the terms that are often associated with this. Some of you may have heard the term sensory processing disorder. However, this is an American term and is not a recognised diagnosis in the UK. In the UK, we would use the term sensory processing difficulties, or we may refer to sensory processing differences. Sensory processing difficulties can happen on their own or may be part of a formal diagnosis, such as the ones highlighted on this slide. For example, sensory processing difficulties are prevalent amongst children with autism spectrum disorder and make up part of their diagnosis. Before we start to talk about the individual senses, we have two slides that help us to think about the role of the brain and the responses that you might see from children. On this slide, we know that the primary job of the brain is to keep us safe, and the secondary job is to allow us to function in everyday life. The safety brain is constantly monitoring the environment for danger. Our brains are wired to register changes in our environment, which is all happening at a subconscious automatic level. Our safety brain automatically kicks into the fight, flight, or freeze response if we feel uncomfortable or unsafe. For instance, if a tiger walked into the room right now, you would not continue to focus on this training video. You would perhaps run, hide, attempt to fight it, or scare it off, or you might find yourself frozen in fear. All of these are normal responses. We don't choose how to respond. It is automatic as these primitive reactions are overriding the learning brain. The secondary role of the brain is to help us function. This may be for some children and young people sitting in a class to concentrate, getting themselves dressed, trying new foods, or even socialising. In order for the brain to do this, it needs a wide range of sensory information. What is really important to remember is that when your safety brain is active, it is harder to function as you're in a highly overwhelmed state. We often get asked, is it sensory or is it a behaviour? And there's not always a straightforward answer. However, what we do know is behaviour approaches won't impact a sensory need, and sensory approaches won't impact a behaviour. This is where knowing your child, watching, and being a detective will help. For example, if a child doesn't like putting their socks on, it could be that they are really sensitive to the sensation of the socks, and to them it feels as if it's painful. Or it could be that putting their socks on means they have to stop playing their favourite game and go to nursery or school. If the child is able to respond to motivators, such as stickers or a reward chart, then their actions are more likely to be behavioural rather than sensory. Often things can start as a response to sensory input, but turns into behaviour because the child likes the reaction from the adult. In turn, this behaviour could then become repetitive. So here we have the 5 senses that you're probably most familiar with: hearing, taste, smell, vision, and touch. This sensory information is received from the world around us from the outside. For hearing, our ears gather auditory information about sounds within the environment, such as passing traffic noise, a phone ringing, or a voice speaking to you. For seeing, our eyes collect information from visual stimuli in the environment, picking up things that we see, their shape, their size, their position, and changes in light levels. For tasting, our gustatory system is made up of receptors on the tongue and within the mouth, and they detect the different substances that we put into our mouth to help us make sense of them. Taste, tactile, and smell systems work really closely together when we are eating and experiencing food. For smells, our olfactory system is the information gathered from our nose. This alerts us to potential dangers such as gas or smoke. This information is processed near to the memory centre in our brains and can trigger an emotional response associated with our stored memories. For touch, our tactile system is one of our largest systems. It is not just what we touch with our hands, but also experienced through receptors across our whole skin system, which detect environmental factors such as room temperature and if things touch our skin and how that makes our skin feel, for example, tickly or painful. We do, however, have a further 3 sensory systems, and the 3 on this slide helps us to process sensory information which comes from within us. Firstly, proprioception is related to body awareness, and this sense gets its information from receptors in our muscles, ligaments, tendons, and joints, all the bits underneath our skin. It lets us know the position of our body parts and our position in space without needing to look. Our proprioceptive sense is especially helpful for efficient movement and helps with determining the correct force to use when carrying out a task, such as grasping an object or throwing and catching a ball. Proprioception can have a calming and organising effect on our central nervous system and can actually help override responses to other senses. So it's one to remember when we start to think about the senses in more detail. Our vestibular or balance system is the information that the brain gathers from some fluid in our inner ear. This helps the brain process different types of movement. For example, it helps to determine whether the body's moving and which way up we are. We can also think about different types of movement and the effect that they can have on how we're feeling. Think about the differences in backwards and forwards movement versus rotational and spinning movement. Our vestibular sense works alongside our proprioceptive and tactile systems for maintaining posture. And because of where the vestibular system is located, it's also connected to our auditory sense. Then we have interoception. Interoception is the receptors in our organs, skin, and muscles, which is telling us how our bodies are feeling. This produces sensations such as hunger, thirst, feeling hot or cold, tired, needing the toilet, feeling sick, in pain, feeling your heart beating, or your breathing getting faster. Our interoceptive sense is linked to our emotional feelings, and it's very important for our self-regulation, which is our ability to control the way that we feel and act. Although we've talked about these senses separately, it's important to remember that these senses work together to help us to function. If you think back to the job of the brain, our brain needs a range of sensory information to help us function, to carry out the things that we want to do, need to do, and have to do in order to engage in everyday life. We're going to go back to talk about the brain and show how these senses are processed. We've got an example here of a child who's wanting to colour in, but this could be you or your child doing any task, whether it's concentrating in class, getting your hair cut, or getting dressed. You might have the background noise and flashing images of the television, brother or sister making noise, the sensation of the clothes, the sun shining through the window, information regarding their posture. The sensory information from our 8 sensory systems is fed into the brain at a level beneath our conscious awareness. This includes all the sensory information from inside and around our environment, which is demonstrated by the cars at the bottom. We have a filtering centre, which can be described as being like a toll gate in a system of cars. The toll gate filters out any of the unwanted or unnecessary sensory information, as shown here by the cars leaving the brain in the picture. This might be the background noise outside a room when you're trying to concentrate, or the sensation of your clothes, or in this example, the sound of the television or other children playing. The rest of the sensory information is then sorted, processed, which allows the brain to send a signal to the body to carry out an appropriate motor or behavioural response, which you can see in the picture of the child being able to focus on the task that they're doing at that moment. But what we know is that this doesn't always happen. Sometimes the filtering centre or the toll gate of the brain is filtering out too much of the information coming from the senses. Imagine your child in the same situation as before. You have the same amount of sensory information coming in, but the toll is filtering out too much, including some of the information that is necessary for being able to focus on the task, such as body awareness. This means that there's very little sensory information available to be able to process and sort, and the brain doesn't have enough information to perform the correct action. It could be that there's 2 scenarios in this situation. One being a child is seeking more sensory input, albeit below the level of consciousness, so the child isn't making a choice. In this situation, the brain tends to look for more information rather than accept that it doesn't have enough. For instance, the brain may send a signal for the body to move or to make noise, as that is a way of increasing the available information from the senses, such as a child who may hum or play with something when actually they should be listening. The second example that may happen is a child who might appear lethargic or understimulated. They're waiting for more sensory input to help them, as there's nothing for them to attend to. In this slide, we've got the same scenario as the previous. The child is trying to focus on his colouring. However, sometimes the filtering centre or the toll gate does not filter out enough of the irrelevant information from our senses. This is shown by the small number of cars leaving the brain in the picture. This means that there's too much information for the brain to process, and it can't be done in an ordered or structured way. Therefore, the brain cannot make sense of the information in order to tell the body what to do. Again, there might be 2 scenarios which are at an unconscious response by the child and therefore not a choice. Firstly, you might see a child experience feelings of being overwhelmed, which may set them into that fight, flight, or freeze response. So they may cover their ears, they may hide under a table to actively avoid some of the stimulus. Secondly, you may see a child who is trying to react to every stimulus, so they appear very distracted and busy. They may be slow to react to instructions because they're just so busy reacting to everything else, such as the sound of a ticking clock. We know that most individuals will go through having all 3 of these states at different points throughout the day, depending on a range of factors. As occupational therapists, we talk about being in a just right state. This means we are at the right level of arousal to carry out the task or activity that we need to do. For most tasks, this will be a calm alert state where we can concentrate and attend to what we need to do. However, low arousal may mean that we are sleepy or distracted, making it impossible to attend to a task. This can be contributed by our environment. Things like low-level lighting, gentle music, or being too warm can send many of us towards the lower end of our arousal levels. This is different for everyone, and what may help one person concentrate may make another feel drowsy or distracted. In a state of high arousal, we may be agitated, overexcited, confused, or anxious. This also makes it impossible to attend to what we need to do. Environmental factors such as workmen drilling outside, having the sun in our eyes, a chaotic or messy environment, or frustrations with IT can all contribute to this. So if you think about the bottom line being your day from when you wake up in the morning to when you go to bed at night, various things are expected of you, or things will happen out of the blue, which may be triggers or cause a build-up throughout your day. So, for example, when you wake up in the morning, we all need something to help increase our state of arousal. So, some of us may have a cup of coffee, we may stretch, we may listen to music to help ourselves get the information we need to function at the start of the day. However, as things happen throughout the day, we fluctuate between having too much or too little sensory information. Our brain will send messages to our body to help us regulate. Many of the children we see find it more difficult to get into that just right state, and they have much narrower range where they feel calm and alert. This is because their sensory systems can over or underreact to the environmental cues around them, making it much more difficult to attend to a given task. A busy or noisy home environment may make it difficult for some children to remain focused on tasks like eating their dinner, as they can't filter out all of the additional auditory information, which could send them into a high level of arousal. Other children may not register enough auditory information to attend to what is being said by their parent, and they may remain in a state of fairly low arousal and appear to ignore their parent talking to them. The same goes for other environmental factors, such as our vision, touch, and smell. Let's take a minute to think about our own sensory systems. Do you find yourself chewing on pen lids, your nails, chewing gum, perhaps when you're nervous or you're trying to concentrate? Do you notice that you sit cross-legged and bounce your knee? What about things like fidgets? Do you doodle when you're maybe listening to me talking right now? Are you playing with a paper clip or a pen? These are all sensory-based behaviours, which ultimately help to provide the brain with the information that you need in that given moment to help you concentrate, focus, and listen. So what can we do? It's really important to have an awareness of sensory difficulties. We need to be a bit of a detective to find out what triggers certain responses. Often think, what does my child's behaviour tell me? We can think about certain strategies that might help. Avoidance isn't always the best thing to do. We need to think about how we can prepare our children and young people. And ultimately, this means being creative, to identifying things to try, ways to implement them to suit both your child and your family. As we go on to talk about the individual senses now, maybe think about how some of these could be used or changed to suit your child. We often get asked if a child can be both under or overreactive to sensory input. The short answer is yes. It's dependent on where you are in the calm alert level that we discussed a couple of slides ago. For example, if you are completely regulated, getting dressed into clothes will be fine. But if you've just had a fallout with a sibling, you didn't have your breakfast, or you don't want to go to school to get dressed, this will be way more challenging. We're going to start with the proprioceptive sense. And if you remember, this is the information that our brains get from our muscles, joints, and ligaments. We know that proprioception can have a calming, grounding, and organising effect on our central nervous system, so it can actually override certain responses to other senses. Most children will typically seek more proprioception, and we wouldn't tend to see an overreaction. This means that most children require more proprioceptive input throughout their day-to-day life. Some of the things that you might see: children having difficulty judging force, maybe running into people or things at speed, slamming doors, snapping pencils, or asking for things to be tighter, heavier, or craving tight cuddles. It could be that children enjoy rough and tumble play or squeezing themselves into tight spaces, such as in between the sofa and cushions. This may be the child that enjoys chewing, whether that be liking chewy or crunchy foods, or chewing the cuffs of their clothes, pens, or other non-food items. So what can you do? Step back and try and watch what your child already does to get this type of input. For babies and infants, think about giving them some swaddling and baby cuddles, giving them opportunity for tummy time, infant massages, and blanket roll-ups. For preschool children, think about activities that encourage them to do pushing and pulling, such as pushing the washing baskets, giving them big bear hugs, giving them a backpack to wear that has toys or books in it, activities such as wheelbarrow walks, or sweeping tasks that encourage pushing and pulling. For school-age and older children, activities such as wall or chair push-ups, engaging them in yoga poses, pushing and pulling games that require them to squeeze and move their hands. You could also think about giving weighted input, such as a weighted lap pad or a shoulder wrap, encouraging them to wrap up like a burrito in their covers or duvet can provide some more proprioceptive input. Helping around the chores in the house, such as sweeping or brushing or washing the cars, can all be helpful activities to get more of this input. You can tailor these activities to your child's preference and use any that match their age and stage. This is an example of a child on the left here who's seeking more sensory input. But giving them a task to do, whether it be sweeping the floor or giving them a bear hug or carrying something heavy up the stairs, you're giving them the sensory information that they're looking for to help them to function in a task. Proprioceptive input only lasts for a certain amount of time, so it needs to be provided regularly. So try to think about it as a cycle of proprioceptive input throughout your child's day. As the pictures show, think about what you've already got in your house or available to you, or what you can encourage your child to do before spending any money on items which would provide resistance or deep pressure. Our interoceptive sense is our understanding of what we feel inside, the signals our body sends to our brain. If there's too much getting in or children are overreactive in this sense, you might see children who are feeling as if they're always hungry, they might always need to go to the toilet, they might feel in pain or thirst sensations much more intensely than what we'd be experiencing. What you can do is to try to encourage your child to notice, connect, and regulate. For babies and infants, babies' interoceptive systems are still in very early development, and we don't know much about this stage. However, it could be helpful to try and keep routines as consistent as possible. Be aware of their signs of discomfort and try to be responsive to their needs. For preschool children, implement distraction techniques. Play a game. Could you go for a walk? Implementing some body awareness games like head, shoulders, knees and toes and Simon Says. Trying some simple breathing games can help your child to notice what's going on in their body. Getting you as parent to describe to your child how they are feeling rather than labeling. So saying things like, my tummy feels empty, it's rumbling, instead of I'm hungry. For school-age and older children, the use of mindfulness can be really impactful. Being more mindful of the body and the feelings and emotions may help them to understand what's going on internally. There's lots of apps online, such as the Mindful Family, Headspace, or Mindful Powers, that can help your child or young person problem solve this. Try attaching a scale to the feeling. So you could say, I'm 2 out of 5 hungry. Or just before dinner, you could say, I'm a 5 out of 5 hungry. Think about really describing the sensations and feelings rather than just labeling them. There's a book called Listening to My Body by Gabby Garcia, or Gray's Anatomy, that can be really helpful. Counting heartbeats or taking your pulse after exercises to notice any changes in their feelings may help them to understand what's going on internally. And you could also get your child to get involved in household chores like sweeping, hoovering, and dusting can also give lots of proprioceptive input and deep pressure. If children are getting too little information with their interoceptive sense, they may be underactive. And you might see children being unaware of their internal signals, such as going to the toilet or knowing that they're hungry. Or they may have difficulty identifying where the signal's coming from, and they might possibly mix those signals up. So they may say they need something to eat, but actually, in fact, they need to go to the toilet. So what can you do? Ultimately, the aim of these strategies are to increase the sensations and the information to the brain. For babies and infants, babies' interoceptive systems are still in that early development, so it's helpful to try and keep routines as consistent as possible. For preschool and younger children, think about having a routine for meals and toilet breaks so the child doesn't forget. You could perhaps use a mirror if you notice that your child is too hot and saying things like, I notice you're sweaty and red, instead of you're too hot. We want to draw attention to the sensations and feelings rather than what we might see. You can encourage your child to take off a jumper, sit down somewhere cooler, and return to the mirror 10 minutes later to see what might have changed. For school age and older children, try to really enhance the feelings. So you could attempt to push down on their tummy to increase the sensation of needing to go to the toilet. Again, describing what you feel rather than labeling. So instead of, I'm hungry or need to go to the toilet, you could say, I feel my tummy is empty, or I notice that you're looking squirmy. It might be helpful to have a bank of words that help describe sensations. If you're hungry, you could use words such as rumbling, gurgling, or fluttery. And lastly, thinking about increasing body awareness through the use of proprioceptive strategies or mindfulness can support. For our vestibular sense, although you might recall certain milestones that your child has achieved, such as learning to walk or run, hop or jump, the vestibular sense continues to develop throughout childhood up until the age of 19, and at which point it starts changing again. Movement can be linear or rotational, therefore, it can have different effects on different people. For children who are getting too much or are overreactive in their vestibular sense, what you might see is children who are scared and cautious to move off the ground or going up and down curbs. They might prefer to keep their feet on the ground. These are children that might have difficulty changing speed and direction when playing games, especially around other children. They might also complain of feeling carsick. This sort of fight, flight, or freeze response to children might feel to them as if they're falling off a cliff when they step off a curb. So what can we do? Ultimately, with this sense, we're trying to reduce the stimuli and prepare children. So for babies and infants, you could think about gentle rocking in a caregiver's arm or a rocking chair, providing slow swinging movements in a baby swing. You could carry them in a baby carrier and provide gentle movements. This could also be done in a slow push chair. What we're looking for at this age and stage is slow, rhythmic movements while they're being rocked, and baby massage is also a really good technique that could work for this. For preschool children, think about giving slow swinging opportunities in objects such as a bucket swing. Help them when they're on your knee by swaying side to side to give some of that movement. Perhaps even some slow rolling on a therapy ball whilst they're lying on their stomach. And lastly, thinking about yoga poses such as a downward dog or a child's pose. For school-aged and older children, think about that more linear swinging on a swing or a hammock. You could get them to be on a padded mat or a wedge and get them rolling in different ways. Rhythmic walking or marching to a beat can help with that movement. And again, thinking about yoga or stretching movements can be helpful. You may also want to try slower movements on apparatus such as seesaws, or allowing them to be in various positions when they're on the couch, such as lying upside down. For a child that is getting too little input from their vestibular sense, so they're underreactive, they're craving more of this, what you might see is children who are constantly on the go. They might find it difficult to sit still during meal times. These might be the children that are real thrill seekers. They might want to hang upside down, or they might want to jump off the sofa or the furniture. And these might be children that are feeling as if they'll fall over if they're not moving. So some things that we can think about. For babies and infants, giving them some more feedback by bouncing them on your knee, engaging them in different types of play such as row, row, row the boat games. When they're giving some tummy time input, give some resistance to that. And you could even support them when they're doing their standing or cruising so they can get more movement. For more preschool, think about your animal walks, so getting them to copy you being a bear, being a flamingo, being a snake. They could jump on a trampoline for a period of time. Activities such as wheelbarrow walks, spinning games such as Ring Ring Around the Rosies, rolling down grassy hills, and engaging them in games such as head, shoulders, knees and toes. For school age or older children, in an appropriate way, spinning on a chair can give a lot of movement, getting them involved in exercise like cycling. We often talk about obstacle courses that include jumping, climbing, and crawling can be really helpful, allowing them opportunities to do tasks such as hopping or skipping. What we often say is watch your child and the signals that they are displaying in that they need to move. Can you give them different positions for different tasks? So do you have to sit at the dinner table for meal times, or can they lie on a beanbag? Can they lie on their stomach to do their homework? We are aware of overstimulations, so it's important to try to figure out a certain time limit or a number limit, such as jumping on the trampoline for 10 minutes or doing 20 star jumps. This will allow structure to the movement that children that typically need this input. Some other things that you could do is adding weight to tasks. You could also add stretchy bands to the legs of chairs for children to be able to push and pull against. Often in schools, they might look at things such as wobble cushions when they're sitting. These can also be called move and sit cushions, or even cushions for Pilates are great to give some extra feedback. Don't worry too much about which activity provides vestibular input and which provides proprioceptive input, as the strategies often meet the needs of both. The tactile system, or sense of touch, is one of the biggest systems, as we spoke about. If we feel the sensation of something that we're not anticipating or that we perceive as a danger, such as the feeling of a fly on our skin or in our vicinity, our brain will tell us to swat it away. For children that are overreactive in this sense, what we might see is children that have a real sensitivity or dislike to certain clothing or labels or textures. Might be children that hate getting their hair brushed or their nails cut or their teeth brushed. Children may avoid certain types of touch, such as messy play or certain foods and textures. Also, children might feel as if their clothes are hurting them, or to them it could be perceived as painful. So it might look like they're fussing about their clothes, but their safety brain is telling them that something isn't right. So what things can we do? Always think about using deep pressure or heavy work before or during light and unpredictable touch. For infants and preschoolers, being in a buggy can give them a barrier for light touch when they're in a busy environment. The following strategies would be appropriate for all ages. Try not to impose touch, Remember that their brain is ultimately keeping them safe because they sense this pain response. Try to break tasks down, such as cutting nails. We often say, can you do one a night to make it less of a big event? And cutting one nail means it's done quickly and with less fuss. You could try to cut off labels or go to certain shops like Asda or Marks and Spencer's to look at their seamless clothing range. Having choice is really important for children, so can you give them a choice between two t-shirts that may have different textures? Trying more proprioceptive input so that deep, firm massage can be really helpful. Doing this before they get dressed can give enough feedback to their body to feel regulated to put their clothes on. Tight-fitting clothing can also be useful. This may seem contradictory, but it engages the proprioceptive sense, which can override that tickly, light sensation of clothing on our skin. Be predictable and firm with touch. The lighter it is, the more tickly it tends to be, which can then be overstimulating. So go firm and deep for these children that are overreactive, which will hopefully allow them to feel more organised and calm. If possible, avoid busy places where your child might need to stand in the middle of a queue because this unpredictable touch is more likely and might be more distressing for them. During bath time, this can be a really nice place to get more tactile input, as bathing is less tickly than the shower water splashing off you. At bath time, try to use rougher towels to dry them and rougher sponges for washing. You could also try adjusting the shower pressure settings or hold the shower head against their skin rather than having it rain down on them. For the opposite, for children who are getting too little information and are underreactive in their tactile sense, you might see a child that has a constant need to touch things. They might like to always have toys or stones or blue tack in their pockets, which could mean if they don't have these things, they are more easily distracted. This might also be the child that doesn't necessarily register pain or temperature. So they might feel that the bath water felt just right, but actually they got burnt. So what things can we do? For babies and infants, think about different textures or fabrics to play with. Offer them lots of different messy play opportunities to allow them to explore with their hands. This will help with their touch and their learning and their play. For preschool, think about incorporating touch into songs and games, such as This Little Piggy Went to the Market or Round the Garden on Their Palm. Implementing messy play can be a really helpful tool to get them used to more tactile experiences in a gradual way. Offering your young child some fidget items. You could look to explore tactile boxes that have a range of different textures for them to explore, and also allowing your child to explore different environments in their bare feet, like sandboxes, grass, and mud. For school age and older children, you could think about exploring tactile art opportunities or exploring different environments in their bare feet, so looking at sandboxes or fidget toys or mud. Sometimes with fidget toys, they might have no purpose, such as blue tack, rather than toys or characters. We might also want to think about increasing stimulation in the mouth through chewing. So, for example, could they have some chewery options? Could they use chewing gum, some crunchier foods such as carrots or ice cubes? The auditory sense is the information we get from our ears. Music can be a great example of sensory input, which can increase or decrease our state of arousal. Some children can be getting too much of this information, and the child that's overreactive in their auditory sense, what we might see is children who are very sensitive to noise. They put their hands over their ears to block out noise. This can be a really effective strategy until they need to use their hands. This might also be the child that hears things that others aren't noticing, such as the hum of the fridge or the ticking of the clock. They might find it difficult to filter noises in busy environments, which might make it uncomfortable or hard for them to concentrate. You might find yourself listening to music loudly in the car and you have to turn it down when you come to a busy junction or when you need to park the car or to follow instructions. This might be the child that also makes noise, which helps them to control noise and it keeps it predictable for them. Children might also feel like their head is going to explode because of the noises and they're not able to filter these out. So, what can we do? For babies and infants, think about providing soft singing or humming to them. Giving them gentle white noise during nap times or quiet times can be useful. And giving them some quiet cuddle time in a safe space. For preschool children, think about offering noise cancelling headphones or earmuffs. They might even be able to get some feedback when using a hat. Giving them the opportunity to play soft, calming music. You could also read them stories in a soft, calming voice. And think about quiet corners or safe spaces for them to block out noise that they may find difficult. For school age and older children, give them the option and choice to use their earplugs or headphones in noisier situations, whether that be in school or with their friends or at tea time. Allowing them the opportunity to look at calming playlists or instrumental music. Meditation and mindfulness apps can also be really helpful to think about blocking out noise that they dislike. Giving them the option to wear their hood up to block out noise, whether that be at home or school, can be just enough to help them filter out that noise. We often say to try and prepare your child for going into certain environments. So think about where they'll be standing or where they'll be sitting. Being at the edge of a room or the back of a room can help them to know where the noise is coming from. Often the what ifs can cause more worry than the event itself. So think about breaking the task down to make things more manageable. And we often say think about having an exit strategy, giving them that permission that they know how to leave, they know where to go if things get too much. We often say try not to speak and reason with distressed children, as this will only increase the senses to process and it actually could cause more overwhelm. For children who are getting too little in their auditory sense and they're underreactive, we might see the child that doesn't respond when you call their name. They might not hear noises that you think they should hear or that they're designed to get their attention. They also might need to make noise themselves. And also they might feel like I was listening, I just didn't hear you. So, things that we can do for babies and infants, think about lots of games that you can use with noise, such as patty cake or providing lots of musical toys that have lights and sound to them. You could also change your tone of voice to increase variations in noises. For preschool and school age children, try not to talk to your child from across the room. Try to get their attention first. If possible, turn off background noise or turn on background noise. Allow children to make their own noise. You could also play around with music and different types of music to help your child or young person register more sensory input. Playing games like musical bumps, musical statues and chairs, or games such as Happy and You Know It, singing and tapping and banging will allow them to make more of this noise. The visual system is all the information we get from our eyes. From children who are getting too much of this and are overreactive in their visual sense, we might see children complaining of bright lights or the sunlight through curtains. Children might prefer to stay indoors because it's too bright outside for them. They might also complain of having tired eyes or be visually distracted when there's too much going on. This may also be the child that has difficulty reading black print on white paper. This also may be the child that gets car sickness. And this can be the result of two sensory systems, the eyes and the vestibular system, which are contradicting each other. Your eyes are sensing movement, but your body isn't moving, which is leading to that feeling of sickness. This may also be the child that feels quite dizzy and confused. So what can we do? For babies and infants, perhaps thinking about having the hood up over their pram to reduce a lot of this visual stimuli. You could also think about sunshades on car windows. And thinking about implementing play, you could introduce light up toys in a really gradual, slow process to help them with their visual sense. For preschool and school age, you might be able to offer your child sunglasses or to wear a cap. to block out some of the light. Try to use lamps rather than ceiling lights, or pull curtains or blinds down slightly to reduce some of this visual input. It's important to try and reduce clutter and place things in the same place each time for a child that struggles with their overreactiveness in this sense. You could also try printing on different coloured paper and fonts. You could block out words when reading a book, or even try coloured overlays. Using deep pressure can really help children to cope with lots of visual information that's happening at once. And lastly, you could think about labelling and keeping areas organised and tidy. In your fridge, you could have compartments for certain items, or their sock drawer, you could have different boxes for their different types of socks and pants. For children who are getting too little visual systems, they would be underreactive in this sense. What we might see, children having difficulty finding things in a busy setting. Children might see part of an object, but the brain doesn't necessarily recognise the whole thing. They might open the fridge and not see things as quickly as you would expect, or they might struggle to find their socks in their sock drawer. They might also feel like they can't find their way in a busy yet familiar setting. So what can we do? For babies and infants, thinking about having more coloured toys, more toys that are visually able to see, you could try looking at mirrors to see their reflection during different types of play, whether that's tummy time or sitting on their knee. Making sure at this age and stage to give lots of face-to-face interactions in the pram or at home or when they're doing any type of tummy or floor time. For preschool and school age, you could think about playing different games, such as Where's Wally, or Kim's Game, Spot the Difference, or I Spy. You could also think about increasing the contrast of text on screens or printing. And lastly, you could think about labelling and keeping areas organised and making sure that they know where certain things are in a very controlled way. Our sense of taste of food detects whether things are sweet, salty, or sour. Our tactile and taste systems work together especially well when we're eating food. For children who are getting too much or are overreactive in this sense, what we might see is a child that has a real sensitivity to tastes. They might prefer bland foods, so they might be quite picky. They might also gag easily. They might dislike strong smells such as toothpaste. And you may also have a child that don't want to eat certain foods and have limited food intake. So what can we do? Ultimately, we're aiming to decrease the stimulation. And we can do that by looking at the following strategies that would be appropriate for all ages. It's important to remember that when weaning a child, you're introducing them to loads of new flavours. To do so, you need to try and persevere as this will change over time. Recent studies show that it takes between 14 to 21 tries of food to become used to that flavour. So trying to have a gradual approach to introducing new foods. Start with similar foods and expand with foods that your children will feel safe with. We know that children need to see, smell, and touch foods before they will eat them, so try to work with having food close to them before expecting them to eat them in a really gradual way. Try not to use food as a reward, but as an opportunity through play and through exposure in a really gradual process. You could offer them non-food things to chew on to give them some of that feedback. Deep pressure, input and strategies will have a really calming and grounding effect, so doing some of these first can be really helpful prior to doing eating and meal times. If possible, try think about the environment and changing the environment. Could you try to have your dinner in the living room or in the dining room? Try to be conscious of strong smells from the kitchen, which may influence whether your child wants to eat in that vicinity. We also have our fussy eating training video available on our YouTube that gives you lots more information about the stages of eating and some further strategies, which you can see at the end of this presentation. For a child that is underreactive and seeking more input in this sense, they may do this by craving strong flavours of food. They may chew, suck, or lick non-food items. This may be the child that has difficulty coordinating their mouth movements, and they may feel like they just want to eat that Play-Doh. So what can we do? For babies and infants, using dummies and teething rings to chew on for exploration in the mouth can be quite helpful to get some of that feedback in their mouth and jaw. For preschool and school age, provide them things that they can chew on, whether that's jewellery, whether that's safe objects that they can mouth. Sucking yogurts or milkshakes through a straw can give a lot of sensation to that jaw and mouth. Try to expand their diet using the foods that they crave and seek, but making them more intense. You could also try stronger flavours of food to give them more of that sensation that they're craving. Our final sense is our sense of smell. For children that are getting too much of this or overreactive in this sense, we might see the child that are sensitive to smells and get easily overwhelmed, although this can be difficult to notice easily. They may be cautious when smelling food and other objects. They might avoid going to certain places or people due to smells such as the kitchen if someone is cooking, and it might also be the child that feels sick when they come into contact with certain smells. As mentioned, our sense of smell is very closely linked to emotional experiences and our memory. So what can we do? Most importantly, being a bit of a detective. It might not always be the most obvious reason, but definitely one to bear in mind. Giving your child a favourite smell to carry around, whether that's on a tissue in their pocket, or their bear, or their piece of clothing. Reducing the changes of smells if possible, so try to keep cleaning products or fragrances in the house or candle smells to a minimum. Giving the child a choice, could they be involved in choosing the fragrance of cleaning products or shampoos or your fabric softener? Also trying to be aware of smelly objects such as candles or perfumes that they may have around them within their house. Gradually exposing and giving control over new smells through play. Engaging your child in play using things like smelly pencils or adding textures of different smells to goop or scratch and sniff stickers. It's important to also have an exit plan for a child if they are in a situation that there is a smell that's really unpleasant for them. You could even think about opening windows or turning on extractor fan to reduce the smells. For children who are underreactive in this sense, we might see the child that doesn't notice strong or unusual smells. They might also smell objects or people very intensely. And this might also be the child that might not recognise that food smells off. So what can we do? We obviously want to increase the stimulation, but it's important to recognise that it may in fact not be a problem. The only risk is that you might not necessarily smell danger, such as burning or gas. Think about children aren't as likely to have an intense emotional reaction to smell, but try to help them to understand about checking dates on food. Discuss with your child to rely on other information such as how does it look, alarms, textures. Having some good self-care routines if personal hygiene is an issue can be really helpful if they're unable to smell themselves. And lastly, try to increase the intensity of smells to help your child get more used to this. So we'll leave you with these main points. The two functions of the brain are first to keep you safe and second to function. If the first is not met, the second isn't possible. Children will cope better if they have a degree of choice. For example, if they have to get dressed, they can help by choosing their t-shirt. Remember, if you're feeling calm, your child will likely feel a similar way. We hope this has been helpful to start thinking about your child's sensory processing difficulties and some strategies to try. But what's next? We have a sensory checklist which is available to download on our website. This can be helpful to do when you see things change with your child, but also if you need to show others who know your child what their sensory difficulties are. So asking school or nursery or grandparents or childminder to look at these can give an indication of how they might present different in different situations. But also it gives you an idea of what strategies to start with first. This checklist here on this slide shows a spike in body awareness and tactile. So our suggestion would be to try thinking about the strategies we've talked about today, such as deep pressure, pushing and pulling, carrying or using heavy objects, dependent on their age and stage. We also have our own website and YouTube channel, which has loads of great resources with more strategies around occupations such as teeth brushing, toileting, dressing, and so on. We also have short videos aimed at younger children and explores how sensory difficulties impact their occupation. And the Kids Scotland website through NHS Greater Glasgow and Clyde have more strategies. They also have a resource creates an All About Me document for sensory strategies. This can be quite lengthy, but it's a really helpful resource if you need more information. The problem solving tool is a little bit like an iceberg analogy, where the tip of the iceberg is the behaviour that we might see, but below we have some of the contributing factors which might be causing that behaviour. It's a helpful resource to sit down and do with others and to think about some of the things you might want to try, as it's often overwhelming to think about where to start. This QR code will take you to a Padlet with all of our resources in one place. We have a copy of the slides, some strategies, the checklist and the scoring sheet, our contact details, as well as links to our Facebook and YouTube, all in one handy place. Within our service, we offer sensory consultations, which you can phone in and book either a phone call or a Teams call with an OT in your locality. These are for you to have an opportunity to discuss with us any specific concerns or occupations that you and your child are struggling with. We would advise that you go away and try some of the strategies discussed in this training before contacting us for a consultation, so that you can know what strategies have worked for your child. Here are some online resources that have some creative and innovative ways to implement some more strategies that we've talked about today. There's multiple ways to get in touch with us directly, and please don't hesitate to contact if you need any advice or guidance with regards to your child's sensory processing difficulties and their everyday occupations. Thanks for listening.